Is DIY brain stimulation with tDCS safe? Have you ever wondered if you could boost your brain power at home? Transcranial Direct Current Stimulation, or tDCS, is a method that applies a low electrical current to the scalp to influence brain activity. It sounds intriguing, but is it safe to try on your own? In research settings, tDCS has been studied extensively and is generally seen as safe when used correctly. The established guidelines suggest using a current intensity of 4 milliamperes or less and limiting sessions to a maximum of 40 minutes. Proper placement of electrodes is also essential. In these controlled environments, there have been no reports of serious adverse effects or permanent brain injury, even among vulnerable populations. However, the safety data we have comes mainly from supervised clinical or research environments. When people attempt to use tDCS on their own, outside of these settings, safety becomes a concern. Incorrectly placing the electrodes, using too much current, or having sessions that are too long or too frequent can lead to side effects. These might include skin irritation, burns, or temporary discomfort like tingling or itching. In rare cases, there have been reports of more serious neurological effects, such as triggering epilepsy in individuals who were previously healthy. The challenge with DIY brain stimulation is that many users may not have the necessary knowledge to ensure they are using the correct settings or placing the electrodes properly. Without medical supervision, the risk of unintended effects increases. Additionally, we do not fully understand the long-term consequences of repeated or unsupervised brain stimulation, especially in healthy individuals. While mild side effects like headaches or dizziness are usually temporary, the potential for more severe or lasting effects cannot be ignored. From a neurotechnology standpoint, tDCS shows promise for cognitive enhancement and treating neurological conditions when applied responsibly. The technique works by subtly modulating neuronal excitability, which requires precise control to maintain normal brain function. Therefore, experts advise caution against unsupervised DIY brain stimulation due to the risks involved and the lack of standardized safety measures outside of professional environments. In summary, while tDCS is generally safe in controlled settings, using it at home carries increased risks. The potential for misuse, lack of expertise, and insufficient safety monitoring can lead to unwanted effects. If you are considering tDCS, it is best to consult healthcare professionals and use validated protocols and equipment to minimize any harm.